viewers, I am Virginia once again, absolutely delighted and excited to welcome you to Nutrient Shield, which is a NutriCast on prevention and nutrition, presented to you by Spina Bifida and Hydrocephalus Association of Kenya, or SHAK Kenya in short, powered by Sanku. We are extremely delighted to have with us a guest who I will allow to introduce herself. Karibu sana.
Hello viewers, my name is Susan Wanjiku. I am a neuro nurse working with Bethany Kids. Bethany Kids is a hospital situated at Kijabe. We take care of children with Spina Bifida and Hydrocephalus, and we have another station that is working closely with children with Spina Bifida and Hydrocephalus, and indeed other disabilities, which is situated at Thika, Joytown Schools. I have done nursing for the last 30 years, and it's my delight to take us through issues pertaining Spina Bifida and Hydrocephalus.
Thank you very much, Nurse Susan, and thank you for making time to come and be with us. Talking about Spina Bifida and Hydrocephalus, for someone hearing those words for the first time, what do they mean? Tell us, break it down in a layman's language.
Okay, thank you for that question. Spina Bifida is a congenital condition where the child is born with the spinal cord not fully fused. It usually occurs in the first month of their conception. That is Spina Bifida. Hydrocephalus in a layman's language would mean, most people know it like this child has a big head, but hydrocephalus is actually a condition where there is blockage of the pathways of cerebrospinal fluid. Cerebrospinal fluid is the fluid that supplies the spinal cord and the brain. It's a very important fluid in the body. So when there is blockage, that is where the head becomes a little bit bigger, sometimes bigger. That is what hydrocephalus is.
Right. Thank you very much. If I may just echo your words, you said Spina Bifida is congenital.
Yes.
Does that mean that all the Spina Bifida cases are present at birth, or is there a possibility of someone developing it later in life?
Yes, Spina Bifida is a congenital condition. It's not only congenital, but it occurs the first 1 month when the child is being conceived.
Wow.
So it is purely congenital.
What about hydrocephalus? Do we have other cases that are not congenital?
Yes. Hydrocephalus is categorized into two.
All right.
We have the one that is congenital, and congenital simply means you're born with it.
Yes.
But we also have another one that is acquired. Acquired would mean you get it after birth, and it doesn't matter the age. You can get it for as long as you have life. So that is what we call acquired.
Wow, that is quite informative. So when we talk about congenital Spina Bifida, and as you rightly said, it happens within the first month of conception. And truth be told, as women, within the first month of conception, you might not even be aware that you're pregnant anyway.
Yes.
So then it is possible to have Spina Bifida without your knowledge that you're even pregnant.
Yes.
But you're already bearing a child who has Spina Bifida.
Yes.
Wow, our viewers, that is so profound, and thank you so much for that. So when you say it starts even before a woman knows she's pregnant, does it mean that there's any way that you can prevent having a child with Spina Bifida pre-conception?
Absolutely.
Tell us about
Absolutely. And I think even as we go deeper in the discussion,
right,
that is a key point. Every woman should prepare for pregnancy, should prepare for the consequences of pregnancy,
right,
should know that it is not absolutely free for you to get a child that is normal. And it is always good to know that you have a responsibility on the kind of a child that you want to get. Even if we would lean on the religious side, truly, there are many ways we could do to prevent you getting a child with Spina Bifida.
Wow. Again, that is deep, that we have a responsibility as far as the child we are bearing is concerned. So allow me to ask you, when you say we have a responsibility, matter Spina Bifida, what would our responsibility be as women to make sure that we do not bear a child with Spina Bifida?
Thank you. Do you know, for the last 30 years that I've been in nursing, I've always looked forward for somebody to ask that question.
All right.
Yes, because when you want a baby, just like I had earlier said, you need to prepare for that baby. How do you prepare for a baby? You need to do a holistic checkup of who you are.
All right.
You know, you need to check what is my blood value? how much blood do I have in me? And what is in that blood? Because as we'll look later on, we'll realize that it is actually the condition as Spina Bifida comes out because of nutrition. Yes,
all right.
purely nutrition. And so if we are checking our blood, what is in our blood? What kind of food am I eating? How prepared am I for this baby? That way we'll be gearing forward to getting a baby who does not have Spina Bifida.
All right.
The prevention part is quite important and key for us.
So, Nurse Susan, I want you to break it down. What do I do as a woman preparing to bear a child in few months? What do I need to do to make my body prepared to have a child who does not have Spina Bifida and or hydrocephalus?
Yes. Thank you again. So what you need to do, you need, as I said, have yourself checked up, do even parasite, deworming, but majorly when we're talking about Spina Bifida, there is one drug, a very simple supplement in this nation of Kenya, and indeed in the whole world, called folic acid.
Wow.
You need to take folic acid at least, not less than 3 months before you conceive. Because as we look later, we realize that Spina Bifida comes up when you do not have folic acid. The mother does not have enough folic acid. Now, folic acid is a tablet. It comes in 5 milligrams. When you take it daily for 3 months before conception, that gives you a big chance for not getting hydrocephalus. But wait, if you were born with Spina Bifida, and not only Spina Bifida, if you were born with any tube defect, that includes cleft lip and cleft palate and hydrocephalus, you need to start taking folic acid once you attain the childbearing age. And actually stop once you can no longer have a baby. We are talking about menopause. Yeah.
Wow.
So all this period between this age when you can get a baby and when you cease getting children, all this time you should be taking folic acid. And please let me add that this is not exclusively for people who have Spina Bifida or have history of Spina Bifida. Indeed, we encourage every woman on the childbearing age to take folic acid, because who knows who is going to get Spina Bifida? Who knows? You don't know until you get a child with Spina Bifida. So we're talking about folic acid, and we are also talking, beside the supplementation, we are also talking of food that gives you folic acid.
I was just about to bring that up, and thank you very much, Nurse Susan. Increasingly, we are seeing in the Kenyan market that many companies, many food companies, many food producing companies, are producing fortified food.
Yes.
We've seen that with rice, we've seen that with maize flour, and I think even wheat flour.
Yes.
So that tells me, as a woman, hopefully preparing to conceive a child, that then I can look for folic acid in the fortified foods. Am I correct?
Yes, absolutely. And I'm grateful that for all the companies that are doing fortification. Today, if you go to our supermarkets, just read what you're taking. Read the fortification. I'm glad that it is in our maize meal. Ugari is our everyday thing. Yes, and so it means a woman who even doesn't know about folic acid, who doesn't know about Spina Bifida, now in this country has a right not to have a child with Spina Bifida because of the fortification.
Thank you. I'm just trying to think that if I, as a woman, because of inadequate folic acid, I conceive a child with Spina Bifida, am I wrong or right to think that automatically I'm a candidate for subsequent children with Spina Bifida if I do not address the inadequacy? Am I correct?
Absolutely, 100%. If you have, actually, when we look at the causes of Spina Bifida, one of them is genetical. And I would also say familial. So if your mother had Spina Bifida, you have got 100% chances of you having Spina Bifida.
Wow.
And if there is a history in your family of a child who had hydrocephalus and Spina Bifida, you equally share the same proportion of you getting Spina Bifida and hydrocephalus. And that now means that you need to be extra careful so that you don't get subsequent pregnancies where your child has Spina Bifida. And indeed, we can tell you from Bethany Kids, we can tell you many families that they have more than one child who has spina bifida.
That statistic is startling, I must say, because I do not think we hear that a lot. But what delights me is knowing that we can actually prevent these two NTDs present at birth, that is congenital, through consumption of fortified foods. You said at least 3 months?
Yes.
Pre-conception.
Yes.
Our dear viewers, the key word is pre-conception. Not after conception, as we see many supplements kick in the moment you get pregnant.
Yes.
But for folic acid, what Nurse Susan is clearly telling us is that we need to increase our folic acid uptake at least 3 months pre-conception.
Yes. I would want to say that nutrition, just as we had said, nutrition is very important in the prevention of spina bifida. And besides folic acid, we need also to encourage our viewers and tell them that food, nutrition is everything when it comes to prevention of spina bifida. And I think indeed most of the conditions that we are now having. Now, we encourage also you taking or eating food that is rich in folic acid. And it's so simple. It's so easy to know the food that is rich in folic acid.
Tell us,
and
please.
That includes all the food you see in a cereal shop. See, as you enter in a cereal shop, all the food that you get there is usually rich in folic acid. Call it beans, call it black beans, call it degu. Whatever you get in a cereal shop is actually rich in folic acid. And not forgetting green leafy vegetables. And when we are talking about green leafy vegetables, we are talking about all our traditional green leafy vegetables. And I believe in this nation, all of us have got our own green leafy vegetables. They are as well rich in folic acid. Things like also fruits, all the fruits that have got carayero. Simply are telling you that they are rich in folic acid. We're talking about oranges, we're talking about pineapples, we're talking about bananas, they are rich in folic acid, and also liver and eggs. Those are very nutritious food and actually rich in folic acid. So as we are doing the fortification, we are taking our natural foods, we are also taking our folic acid, which is 5 milligrams. We are simply saying no spina bifida for us.
Thank you.
Yes.
Our viewers, as you've heard, the food choices that you make have a direct impact on the quality of child that we are going to bear. That is very, very profound. Nurse Dean, thank you so much for that. We've really learned a lot, both myself and I'm certain that our viewers have as well. So as we go on talking about the conditions, the moment you have a child who has spina bifida and or hydrocephalus, tell us about the life of this child. How is it living with the condition? Matters medical, matters everything, an all-rounded life.
Yes.
You've gotten a child with spina bifida and or hydrocephalus.
Yes.
Tell us more about that.
Thank you for that question. I know once we have children with spina bifida and hydrocephalus, I've seen it in the maternate wards. The mothers are so devastated. The parents do not believe that this is happening to their own children. And I would want to say, besides a child having spina bifida and hydrocephalus, there are many other complications attached to them.
All right.
It is a devastating condition at first, but not when you have met people you can work with.
Right.
I would want at this point, before we talk about the complications, I would want to give everybody who've got spina bifida and hydrocephalus hope. I would want to tell them there is no reason why this child cannot live a full-blown life.
Wow.
There is no reason. Now, but this is a catch, that you've got to work with the experts from day one.
All right.
You've got to know, who do I talk to? You've got to know that you are not a case in isolation. As I said, I'm working with Joytown Schools at Thika. We've got in our program, sponsored by Bethany Kids, we've got 163 students.
Wow.
That tells you that they can as well go to school.
Yes.
They can read normal lives. Now, here is a catch. You've got to know as a parent what are the complications. The complications are all rounded because as you realize, anything that touches the spinal cord, anything that touches the brain, truly damages quite a number of organs in the body. And one of the biggest problems that these children have is that they get a neurogenic bladder and then they get a neurogenic bowels. That simply means they cannot control their urine, depending with the degree of their sensory feelings. So quite a number are not able to control their urine. They are not able to control their stools. And this is where we come in as an institution. This is where Bethany Kids come in. We will train you what to do with your urine. We'll train you matters concerning catheterization. You're able to remove your own urine normally, and you can even evacuate your own stools normally. So when you come to us, when we get you in our clinics or in our hospital at Kijabi, we will work with you. And good news, let me tell you,
Yes, please.
Virginia,
Yes, please.
Bethany Kids is committed to work with you for lifetime.
Wow.
From day zero, when we meet with you, day one, to your lifetime, whether it's 70 years or 80 years or 120, for as long as life endures. So we work with them. We show them how to take care of their bowels. We show them how to take care of their stools so that they are socially acceptable. Now, those who are not able to walk, most of them are not, again, depending with the severity of spina bifida, because spina bifida comes in different presentations. There are about 3 presentations, you know, and the worst case scenario is where you cannot walk, you cannot be able to control, as I've said, urine and your stools. So we will work with you, we'll give you appropriate assistive devices. So we'll either give you a walker, either give you a crutch, either give you a wheelchair. So we will work with you and show you what to do. Now, one of the complications of spina bifida is actually hydrocephalus. So we will as well intervene and take care of the hydrocephalus, do what we should do so that we can control, you know, your CSF can be controlled and you can live as a normal person. So we will work, there'll be different people working with you. We'll have a mentor.
Right.
A mentor tells you, wow, this happens to many others. You are not a case in isolation. So we will give you spiritual guidance. We'll also have a nurse working with you. We'll also have a doctor, a neurosurgeon in this case, who does your shunting or spina bifida crusher. We'll also have an orthopedic surgeon.
Allow me to cut you short, and I'm very sorry for interrupting.
Thank
You've
you.
just talked about spina bifida closure and a shunt.
Yes.
Please explain to our viewers what those 2 interventions are.
Okay. So when a child is born with spina bifida, whatever quarters, they will simply come back to the hospital and say, I have a wound at the back. By the way, Virginia, I should have told you.
Yes, please.
For you to realize that your child has spina bifida, there's usually a wound at the back or a protrusion at the back.
Along the spine?
Yes, around the side,
All right.
around the spine.
All right.
That is what will tell the mother, my child is not normal.
But if you get a child in hospital, then the medical team should pick that up. Am I correct?
Oh, yes. At the
Right.
maternity wing, the nurse will pick it, the midwife will pick it, and, you know, tell you this is spina bifida, and this is how you go about it. So usually when they see the wound at the back,
Yes.
we encourage that within 24 hours, please rush to the hospital. Come to us. So because why 24 hours? And I'm meaning 24 hours after delivery. So in case of a child who is born at home, rush them to the hospital because there is a communication of the cerebrospinal fluid which is oozing at the back, and that becomes a very good media for infection. So the surgeons who do spina bifida crusher,
All right.
they will actually cross it because most of them will develop hydrocephalus. The doctor will be able to quantify this is a candidate for shunting. And so we do the spina bifida crusher and do the shunting.
What is a shunt, Nurse
shunt,
Susan?
yes, shunting is a procedure we do so that we can control the excessive cerebrospinal fluid. Remember, I said there is a blockage, blockage at the brain. So a doctor is going to put a plastic tubing from your head all the way, and they will put it down at the abdomen. That is where the cerebrospinal will be absorbed because cerebrospinal fluid is part of the body. So it is inserted at the abdomen and it is able to, the nutrients are able to be absorbed back. And so it will mean that this child with hydrocephalus is going to live a normal life like you and I.
But
yes,
this child will be VP shunt dependent.
Yes, this child will be VP shunt dependent.
Right.
And I should say, allow me to say,
Yes, please.
that because the medical field, the doctors, the scientists are doing research every day of their lives, there is also another procedure that is done. And this procedure, the doctor will put hose. It's called ETV. I don't want to go to the details so that we don't confuse our viewers. But the doctor is going to put small hose in your brain,
Right.
where the cerebrospinal fluid flows, and so it will evade the obstruction, and the flow will be like for a normal person.
Right.
And that one now will mean there will be no shunting. So who makes the decision whether you're going to have the shunt or have the ETV? Is your neurosurgeon.
It's my neurosurgeon.
Is your neurosurgeon.
So I read
Yes.
that a VP shunt is the medical device with the highest failure rate in the world.
Yes,
Is that correct?
that is true.
What about ETV? What are the chances of it failing? And I think for our viewers, ETV is endoscopic third ventriculostomy,
Yes.
which is alternative to a shunt.
Yes.
So is there a possibility of ETV failing?
Well, that's a deep question. Being a human being, I don't want to say it's 100%,
Right.
but it is far much better than VP shunting.
Than a VP shunt.
There
What
may-
makes you say that?
Yes, what makes me say this is because the chances of you having a VP shunt revised in your lifetime are high. You could have this done 3 times in your life. Either it is not working, that is shunt malfunction. Either it is short, which is rare because it's plastic. So, or there is an infection that has occurred. So the doctors will have to remove it for one case or another. But for the ETV, there are chances that you don't have to have it done again in life.
Wow.
Yes.
That is wonderful. So if we can go back to the conversation around, you called it neurogenic bladder
Yes.
and neurogenic bowel.
Yes.
Right. So that is what, as you explained, brings about incontinence of bladder,
Yes.
of urine and stool.
Yes.
And you talked about catheterization.
Yes.
Perhaps you can break it down for our viewers. What do those 2 procedures mean and what do they entail?
Yes, thank you for that question. Now, when we are talking about opening our bowels, allow me to say that for a normal person, for you opening your bowels, waking up early in the morning and going to the toilet may appear normal. But may I shock you that there are around 5 messages sent from your brain to either your rectum or your urinary bladder to tell you that you need to go to pee. Yes. So for this one with a neurogenic bladder, they do not have the capability of getting it from our mother pituitary gland, our mother gland. They do not have that capability simply because their nerves were damaged. So what Bethany Kids does, we introduce you to a procedure called CIC, standing for clean intermittent catheterization. We show you, it mimics the normal opening of your bowels and going to pass urine. So what you do, you have your own catheter, which is this is not a sterile procedure, it's a clean procedure. That's why we are calling it CIC, standing in for clean. Your hearts, your hearts are clean.
Yes.
Where you correcting it from is clean, and everything around it is clean. I stands for intermittent, another English word for interval, that says every 3 hours you go to the toilet and do catheterization. And the last C is catheterization. Of course, a plastic tubing, which is a catheter, is not like the normal catheter that you know of. This one is a straight plastic catheter. And we teach our children, Virginia, do you know we teach our children who are about 6-7 years old, they do catheterization on their own, because again, we want them to be independent. So every 3 hours they go to the toilet and they drain their urine. That way, they are going to be dry, they're going to be socially acceptable, and everything around them looks like a normal life, which should be. So that is a neurogenic bladder for you.
Yes.
The neurogenic bowels, we've got 2 procedures that we do for them.
Yes.
Now remember, they are eating like us. They're doing everything like us. But apparently, they do not know this is a time to go and open up their bowels. Even if they do, then they are not able to completely open up their bowels. So what we do two procedures. One procedure is called digital stimulation. We allow them to go to their rectum, use one digit, of course, when they are graft, they stimulate the digit. I use this for the rectum, and I'll use this for the digit. Of course, we use this digit when you're graft, and they go in through their anus, and they stimulate their rectum using a chronological order, like they will do it clockwise. They will do it they can do it 5 to 10 times. Then they will get the poop that is there, which is usually very dry. Remember, when you're not opening up your bowels, what happens is that the stool, the body automatically absorbs the waters back, and so this stool is very hard. So they will remove it, and they will continue. The bowels will just come out. So now that being said and done, because they are not able to open their bowels like any other normal person, they usually have something we call stool impaction. Like a lot of stool will be lodged around the small intestines and the large intestines, part of it at the rectum, and they cannot just remove it. So we introduce another procedure that is called bowel washout.
Right.
It's similar to what we knew like enema. I believe many women will relate with enema, because we used to do it in our in our maternity wings. So we introduce a true enema with pure water, just warm water. Put it in a bag, a customized bag, which can be found at Bethany Kids. Even the catheters, you cannot buy them anywhere in this nation. We do not have them as yet. So we get them from Bethany Kids, and as I said, we supply them to all our clients. So when we introduce the bowel, using a bowel washout kit, we introduce the water via the anus to the rectum, to the large intestines, and to the small intestines. And once we have introduced the water, say like 200 to 500 mils, depending with the age of the child, it will dislodge the poop around that has been lodged. And then the poop, we tell them to hold for like 5 minutes, and then we release it. And let me tell you, it's a real washout. It's a real relief for our children. It's a real washout. You know what that means?
What does it mean?
It means that we are not expecting them now to use diapers. We are not expecting them to, the way they will have, they'll be so worried. I'm taking, I want to go somewhere, I want to work, and my poop may come out anytime. So once we have done washout, usually we do it 3 times in a week. Those people are as clean as me and you.
Our dear viewers, what for me has come out very strongly is that the natural processes we take for granted, feeling like you want to go have a short call, feeling like you want to go for a long call, are not natural for persons with Spina Bifida and or hydrocephalus. Something that we perhaps take for granted many times. I believe we do, me being one of us. I am very, very astounded to learn that for some of us, those with Spina Bifida and hydrocephalus, they have to do the CAC every 3 hours.
Every 3 hours.
And the bowel washouts 3 times a week.
3 times.
Using materials that are not locally available, currently only at Bethany Kids.
And I should say, allow me to say,
please,
that Bethany Kids has got 22 satellite clinics in this nation. Our mobile clinics are always on the run, ensuring that we've duly taken care of our patients. And remember, I said, it's not age limited. It's not.
It can happen to anyone at any time.
As in, we will follow you for as long as life endures.
Right. Thank you for the correction. Wow. Thank you so much for such an informative session. As we bring this to a close, just to wind up the discussion that we've had, can you tell us about what are the major causes of Spina Bifida and or hydrocephalus?
As we had said, one of the causes is folic acid, still spearhead folic acid. There are maternal causes. Maternal causes includes a number of things. What is the condition of the mother when you are expecting? Situations like when the mother is obese can cause spina bifida. Situations like when the mother is exposed to environmental conditions which are hazardous, like people working in chemical related factories could as well contribute to spina bifida, because what it does, it will interfere with the DNA synthesis of the baby. So that is one big cause. And of course, we said genetics, if the mother had, if there is a family member who has had folic acid, the whole family should be prepared. There are other reasons.
Yes, please.
And one of the other big reason is under the category of nutrition.
Yes, please.
Aflatoxins. Aflatoxins. And that comes under food security, of course, which is a very big chapter that we can talk about. But we've realized that people who come from regions, especially that are growing maize or growing groundnuts, and the drying process is not well done, it can cause aflatoxins.
Okay.
Those are some of the major reasons.
All right.
Yes.
So, our dear viewers, as you've heard it, when the mother is obese during pregnancy, or if there's a genetic contribution as well, and also if the mother is to eat food that has aflatoxin, then automatically there's a risk of getting a child who has spina bifida and or hydrocephalus. As we bring this to a close, Nurse Susan, what is your clarion call?
Before we go to the clarion call, allow me, because of the previous question you had asked, what about hydrocephalus?
Yes, please.
Hydrocephalus, one of the causes of hydrocephalus is, of course, spina bifida, but again, the maternal causes is during delivery. And that's why we are calling on our parents. Let's go to the hospital to get our babies. When you've got small children and they are pregnant, Kenya now has got so many pregnant adolescents pregnancies, please take care of that child, because when we come to the second stage of labor, and when I'm talking about the second stage of labor, I am talking at that stage that now the baby is coming out. If the mother has had prolonged labor, many days you're laboring and you're not able to get the baby. Of course, most of those parents would benefit from cesarean section. If this doesn't happen, then the meninges of the baby are really pushed. They are pressed, and that is another cause of meningitis. For the congenital meningitis, talking about the acquired meningitis. When you've had a child and they've got meningitis, they've got other conditions like encephalitis, that includes the brain. One of the other complications then again is hydrocephalus. And so when a baby is sick, please, let's go to the hospital. Even as an adult, don't just assume it's headache. Just go to the hospital. And what about road traffic accidents? When you've had an accident, which is another major cause for hydrocephalus, don't just say, I'm okay. You just dust yourself and go to your normal life. Go to the hospital where it will be established whether you may have acquired hydrocephalus. So those are some of the things that we can do, and many more that would prevent both spina bifida and hydrocephalus.
Thank you very much.
Yes. What would be my call to the parents?
Yes, please.
What would be my call for this nation of Kenya? Let us prepare for pregnancy. Let us not just wait to hear the baby. Let us prepare for pregnancy. Let us know that we are preparing to bring a child, and that child needs to be taken care of. And Virginia, that is a difference between us and the other world. What is the other world called? Of course, not the third world country.
The Western.
The Western countries truly prepare for conception. So I would ask our parents and I would ask us, let us prepare for conception. Now, and I would want to say, in case you have a child with spina bifida or comes from a history that has spina bifida, you're not going to take folic acid for 3 months, as we had said.
Yes.
You will take it for many years. I said from the time from childbearing until the time when you stop, when menopause occurs. And should I say that we've got one case in scenario, that will be my part in short. We had one student admitted at Joytown High School. And she was born with spina bifida. The mildest spina bifida is called spina bifida occata. And she had spina bifida. And we said, as a rule, the school through Bethany Kids insists that you must take folic acid throughout your schooling period with us.
Wow.
And this girl duly did it, religiously took folic acid. Things happen like they happen. The second year, she conceived.
Wow.
And the nurse that I am, I'm asking what happens to us now. We quickly do ultrasound to rule out whether the baby now has spina bifida. And I'm so proud to say, thank the God of heaven, the child was born without spina bifida or hydrocephalus. What does that tell us today? It tells us food fortification, taking folic acid, taking the proper diet that has folic acid, taking a balanced diet can really take care and can really cause us, even if you come in from a background where you have spina bifida and hydrocephalus, you can have a normal child who enjoys a normal life.
Wow.
Yes.
That is powerful. For me, our dear viewers, what has been my take-in? My take-in is that the moment you're of childbearing age, you need to really look at your diet, consuming foods that are healthy, and especially being keen on the folic acid that you take. So now, Susan, as we wrap up, and I'm laughing because of the myths that we hear out there.
Yes.
Just to wrap up, perhaps you can just have a quick fire section.
All right.
So the first question I would pose to you is witchcraft directly related to spina bifida and or hydrocephalus?
No.
You had it. Second question, do you get spina bifida and or hydrocephalus as a result of a curse in your family?
No.
Thank you. And the last one,
yes.
Does nutrition directly affect whether you get a child with spina bifida and or hydrocephalus?
Absolutely, 100%.
Wow. So you had it. Spina bifida and or hydrocephalus are not as a result of curses, neither are they as a result of witchcraft. And yes, nutrition, the choices we make matters food, do have a very, very direct and great impact to the child that we are about to get to bring to this world. Our dear viewers, in our next episode, we will be graced by a caregiver to a child with spina bifida, and we urge you not to miss that very exciting episode. Bye.